Welcome back to the Best PT Podcast. This is episode 4.8, talking about cardiovascular procedures. Starting with atherectomies. This involves a rotating shaver that cuts plaque out of an artery to increase blood flow in the heart. An automatic implantable cardioverter defibrillator, an AICD, is similar to a pacemaker. It monitors heart rhythms and delivers electrical shocks to prevent arrhythmias. Balloon angioplasty. A balloon is expanded at the spot of a blockage in an artery. It's usually also combined with a stent to prop an artery open further. A balloon valvuloplasty is the same as a balloon angioplasty, except it's used for heart valve stenosis instead of coronary artery stenosis. Cardiac ablation is the use of radiofrequencies or chemotherapy to destroy myocardial tissue that is causing arrhythmias. Cardiac pacemakers are implanted under the skin, usually in the left anterior chest wall. They are used to increase heart rate and prevent arrhythmias. Cardiac pacemakers have what's called pacemaker codes, which are reported as a number of letters. So the first letter in this code refers to the chamber that is paced, that is, which chamber is the pacemaker stimulating. O is none, A is just the atrium, V is a ventricle, and D is both. The second letter in the code refers to the chamber sensed, that is, the location where the pacemaker is evaluating normal cardiac activity. So here again, O is none, A is the atrium, V is the ventricle, and D is both. The third letter refers to the response sensed, that is, the pacemaker's response to what it detects in the second letter of the code. So O again is none, T refers to triggered, so sensed activity triggers pacing by the pacemaker. I is inhibited, so sensed activity can inhibit pacing by the pacemaker, and D again is both. The fourth letter in a code is the rate modulation, whether or not the pacemaker can respond to physical activity. So some pacemakers allow the user to exercise, and some do not. So if you have a patient with a pacemaker and the fourth letter in their code is O, that means their pacemaker cannot tolerate exercise. But R means rate modulating, which means the pacemaker can. And finally, the fifth letter in the code refers to multi-site pacing, whether or not the pacemaker is actually sensing and pacing multiple atrium or ventricles. So again, O is none, A is atrium, V is ventricle, and D is both. Common pacing modes, so AAI means the atrial is being paced and sensed. VVI means a ventricle is being paced and sensed. And DDD means that both the atria and ventricles are being sensed and paced. This is the most common pacing mode. If you come across somebody with a pacemaker and the first and second letters are O's, meaning that there is no chambers paced and no responses sent or activated, it usually means the pacemaker is being used for evaluation purposes. Moving on to cardioversion, it's the use of a defibrillator to shock the heart back into a normal rhythm. A coronary artery bypass graft, or heart bypass, also called a CABG, is using the patient's saphenous vein, internal thoracic artery, internal mammary artery, and or radial artery to bypass occluded coronary arteries. You may commonly hear terms such as CABG times 2, which means 2 arteries have been bypassed, or a CABG times 4, which means all of the coronary arteries are being bypassed through grafts. CABG patients almost always go into cardiac rehabilitation following their surgery. Enhanced extracorporeal counterpulsation, EECP, is the inflation of pressure cuffs on the lower extremities to compress the veins and assist with venous return. Heart transplants are used for end-stage heart failures. Intra-aortic balloon counterpulsation, IABP, is the inflation and deflation of a balloon inside the aorta to provide circulation assistance following a heart attack. Valve replacement is the use of a prosthetic valve to replace leaky or non-functioning heart valves. They can be an autograft, so the person's own valve tissue, or an allograft either from a cadaver or sometimes even a pig. And finally, ventricular assistive devices are pumps placed inside a ventricle in order to bypass a faulty ventricle. They can either be a left or right assistive device. There can also be biventricular assistive device, or a BIVAD, which bypasses both ventricles. This is used as a treatment for patients with heart failure or those waiting for a heart transplant. That does it for episode 4.8, Cardiovascular Procedures. The next episode, 4.9, will talk about pulmonary pharmacology. As always, the outline will be in the show notes. Thanks for joining me.